Good afternoon, everyone. I'm Tamiko Brown-Nagan, Dean of the Radcliffe Institute for Advanced Study at Harvard University. I'm pleased to welcome you to the latest installment in our virtual Radcliffe discussion series, exploring health equity in the time of COVID. Before we begin, I want to acknowledge the members of the Radcliffe Institute Leadership Society and all our annual donors who are watching this afternoon. Your generosity keeps Radcliffe programming free and open to the public, and we thank you. As I've mentioned at the outset of each of our webinars, this discussion series reflects three critical elements of the Institute's mission. First, it reflects Radcliffe's commitment to examine and address pressing issues facing our society. Second, it reflects our commitment to cross-disciplinary research and our conviction that insights from across academic disciplines can advance public discourse and reveal innovative solutions to complex problems. Third, and finally, this series reflects the Institute's commitment to equity and opportunity. We know that COVID-19 continues to disproportionately affect vulnerable and marginalized communities in myriad ways. Together, we have a responsibility to examine the disparities that this crisis has revealed and exacerbated, and to help chart a more equitable way forward. These discussions are a part of that effort. Today, our focus is on the unique challenges confronting LGBTQ individuals and communities across the United States. Sexual and gender minorities have long struggled for equal access to healthcare, and LGBTQ people are more likely than their straight and cisgender peers to suffer from certain chronic health conditions which appear to be associated with higher COVID-19 risk. Social isolation and certain mental health issues are also more common among LGBTQ individuals, and COVID-19 has forced many organizations to curtail social supports. The pandemic has also interrupted pride and other events that build community and that can be vital to the well-being of people who otherwise feel isolated and vulnerable. These effects are perhaps most acute for LGBTQ people of color and others who face multiple intersecting barriers to full and equal participation in society. But there are also hopeful signs. With last Sunday's rallies for Black transgender rights and last Monday's landmark Supreme Court ruling protecting gay and transgender employees from workplace discrimination, the struggle for LGBTQ equality and the LGBTQ community have been affirmed. To guide us in examining these challenges and opportunities and envisioning a more equitable future, we're joined by four distinguished speakers. Katie Batza is Associate Professor of Women, Gender, and Sexuality Studies at the University of Kansas. Dr. Robert Goldstein is Medical Director of the Transgender Health Program at Massachusetts General Hospital, an instructor in medicine at Harvard Medical School, and a candidate for the US Congress. Jessica Halem is LGBTQ Outreach and Engagement Director at Harvard Medical School, and Dr. Cecil Webster is a lecturer in psychiatry at McLean Hospital and Harvard Medical School, as well as a diversity health outreach consultant. I'm grateful to each of our speakers for being here this afternoon. Thanks to all of you. And now it's my pleasure to give the virtual floor to Jessica Halem.
Wonderful. Oh, what a wonderful opportunity this is. Welcome, everybody. Thank you so much, Dean Brown-Nagan. I am honored to be here at Radcliffe. I am quite struck by your remarks. What an auspicious moment this is. Honoring 5 years ago, what happened at the Supreme Court, granting same-sex legal marriage across the United States. Another great Supreme Court ruling recently as well. But it's quite auspicious to be here with you all in the Radcliffe community. I can't help but reflect on your history as a women's college and think about, for myself as a now older lesbian, I can't help but think about all of the young lesbians that might have been at Radcliffe way back then and might have struggled to be seen, might have actually been persecuted and shamed. And I can't help but think that we are here on behalf of them, righting some wrongs that might have happened for those young women at Radcliffe. Of course, I'm struck by this year, we are honoring the 100th anniversary of the secret courts at Harvard University, in which gay men were persecuted, suicide occurred. Terrible, terrible, shameful history that we have when it comes to how we have treated LGBTQ people. And the reason why I bring that up is because when we talk about the challenges that LGBTQ people face, I want us to be mindful that we do not face these challenges because of some innate interior problem. We are born perfect, born beautiful people, right? We become who we are. But it's really all of the society and all of the family and the cultural institutional problems that really cause us so much stress, shame, and stigma. So I always want to be mindful of the road that we have traveled to get here, and how we have so much momentum to overcome some of the more dark histories that have caused some of these challenges. But of course, there's a lot of momentum. Things have changed. I know I'm on the phone today with a lot of historians, so I won't claim to talk about the progress narrative too much, but I do want to be mindful of that feeling of momentum that we had as a community and what it felt like when COVID hit. It felt like this giant halt to our community gatherings, to our schooling, to being with our friends and loved ones, and having to potentially live with family where a lot of homophobia and transphobia might be occurring. So I want to recognize all of that stuff that sort of makes us who we are. And we've brought together a group of people to try to make sense of it all. And I couldn't be more proud to be joined by my colleagues today to really try to make sense of it. Where have we come from? What sort of skills do we bring? Where have we been before? What do we have to learn? And what do we have to teach the rest of the world about how we operate, cope? What's the strength of being an LGBTQ person today? So I'm so honored to be here. I'm honored to be a part of this community who's trying to figure out these important questions and welcome in the challenges of supporting and celebrating the LGBTQ community. So let's start with a historian. I'm so thrilled to be joined today with a wonderful historian, Katie Batza, who did spend some time with us in Cambridge recently at Harvard, and will help us really put this COVID moment and LGBTQ health into a larger historic arc. Katie?
Thank you, Jessica. Yes, so I come at this as a historian, as Jessica suggested, to kind of provide a larger context. My first book looked at the creation of a gay medical infrastructure in the 1970s and the period before AIDS, and then really kind of use that moment as a way to frame and understand the way that health and disease can be used as kind of a political pathway forward to either create community and empower LGBTQ communities, or to try and be violent against them, or to trying to dismiss them in different ways. And so using that kind of framework, I think we can apply the way that we understand pandemics and the way that it intersects with LGBTQ identities and other minoritized identities to really understand how health and sickness impacts this community in particular. I think in terms of COVID-19, Jessica, you really thinking about the role of community. In my work, I've looked at the venereal disease epidemic of the 1970s, the AIDS epidemic of the 1980s and 90s that continues today, and then now looking at COVID-19. And one of the through lines that I find is the role of community, whether that is LGBTQ communities turning to each other to build health centers as they did in the 1970s and 1980s, or whether it's LGBTQ individuals looking to other folks to house them and help them as we are encouraged to shelter in place and we're trying to find safe places. And so COVID-19 provides a really particular difficult challenge to our community where being able to gather and provide a sense of kind of group solidarity is really challenging at this time.
Oh, great. Oh, wonderful. Sorry, I am, I'm being a gay multitasker here. Katie, thank you. So I wanted to start off with some history, and then I wanted to ask a current frontline doctor who has been, who I think just 5 minutes ago was serving patients and has now run to join us all today. So we're very lucky to be part of a Harvard community with really incredible out gay doctors like Robbie Goldstein. Dr. Goldstein, give us your report from the front line.
Thank you, Jessica. And everyone, thank you for being here today. I'm so excited to be on this panel. These are amazing folks that I get to join today. Jessica is right. I was just running over from clinic to get here to be with all of you. And I want to sort of just share a little bit about what I do and the perspective that I have in how COVID-19 has affected the LGBTQ community. As you've heard, I'm an infectious disease doctor, and I have an active outpatient primary care practice for people living with HIV and at risk for HIV. It's largely made up of gay and bisexual men. I'm the medical director of the Transgender Health Program at Mass General Hospital, which has allowed me to build a primary care practice for trans and non-binary folks all across the age spectrum. Our program has people as young as 6 and 7 and as old as 85. And we've been able to care for them and see how COVID has impacted that community in very different ways. And then, as you heard in the beginning, I am running for Congress in the state of Massachusetts, and so I've had an ability to really think about policy and the way that those that are most marginalized, most vulnerable in our society were impacted by COVID-19. And I want to sort of just share in these brief introductory remarks what I've learned from my patients, what I just learned a half an hour ago being in the room with patients. You know, I think that the response to COVID in the LGBTQ community can really fall into almost 2 different buckets. For those that are a little bit older, who were around in the 1980s and 1990s, who experienced a pandemic before, an epidemic of HIV within the community, for those folks, there is a lot that is coming back to them, a lot of trauma that is being resurfaced, but also a lot of resilience of the understanding that we have been here before and we can get through this again if we all work together. They understand what it's like in some ways to be isolated, to not be able to talk to family and friends, to not feel that same connection that you have when you're out and walking around on the streets. And so I've been talking to a lot of people, in many cases, a lot of older gay men who lived through the 1980s and 1990s. There's another group of people, and I don't want to generalize too much, but it's a lot of the younger folks who I see in the Transgender Health Program, non-binary folks, people who haven't had to experience this before. And now for the first time, they are being isolated. They are in a home where they may not feel affirmed. They may be away from the college or high school where they have the after-school group or the organization that supports them. They are having to tackle a whole new problem in a totally different way. And for those people, it has been really hard. It's been a really challenging 4 months. And some of the disparities that we saw before COVID have become even more prevalent. The disparities in mental health, the disparities in the ability to obtain healthcare, whether it be surgical care for trans folks or medical care. And then I think I just want to take a step back and say, from the policy side, from that other part of my life that exists right now, it's been incredibly clear to, I think, everyone that those that were most marginalized, those that were most vulnerable before COVID, those were the ones that were impacted the most by this virus. They were the ones where they didn't have the resources in place. We didn't build the structure that we had to build, and we are now dealing with the consequences of that. And it's really important that we keep that in mind as we think about our rebuilding and we think about how we get back to a society that does bring justice to all of these folks, brings healthcare to all of these folks, brings them all in to the society that we want them to be in. So I'll leave it there, and we can go on more in the questions and answers.
Yeah, that's great. I really love getting to understand the range. When we say LGBTQ, we're actually talking about a lot of different experiences, a lot of different groups of people. It's one of the challenges and beautiful parts about our community. when I think of beautiful parts of our community, I think of Dr. Cecil Webster, who helps me understand this constant conversation about mental health challenges. How, me as a queer person, how am I not supposed to feel challenged all the time by talking about mental health challenges?
Yes, absolutely. First of all, thank you, Jessica, for your lovely introduction. And thank you to the Radcliffe community for inviting us to have this really important conversation. To expand a little bit on some of the things that Robbie and Katie, and of course you, Jessica, have touched on, let me also share a bit more about the framework with which I work, some of the things that I do, as it relates to how we can start to look at some of the difficulties that we've been having during this present moment. So I'm a child and adolescent psychiatrist as well as an adult psychiatrist. So I get to hang out with a lot of kids and a lot of adolescents and young adults. I have a small private practice where I do a lot of psychotherapy. I'm also a candidate in psychoanalysis. And psychoanalysis is a way that we can understand the sort of unconscious processes of our brains and our minds in understanding how we interact with our world and how we imagine our world interacts with us, real or imagined. And one of the things, very similar to Robbie in terms of being really informed by our patients, one of the things that has been a really frequent theme recently has, again, been that theme of isolation. This gets a lot more complicated for populations of color, people of color, especially young people of color. While we have our gender and sexual communities, gender and sexual minority communities, that can be really affirming to how we see sexuality, explore sexuality, get to know ourselves as like gay men or lesbian girls or trans feminine individuals. A lot of that access to these communities have been curtailed in some ways. And these communities typically are much more focused on whiteness, on cisgendered identities, and also maleness. So for many people, many can feel really left out of those communities, or at least not highlighted. And on the other side, many individuals, individuals of color especially, have communities that might not know necessarily about the sexual or gender minority aspects of their life. So for many people, they're left in the lurch. Not quite being fully supported by their gay and lesbian community, for example, or not quite supported by their Latinx community. That's obviously not the case with everyone, and there are many different communities that fully embrace all of ourselves, but there are many more that feel that their whole selves can't be fully understood or acknowledged at a very critical time where support is needed. So you have the dilemma of how do you choose parts of yourself? What parts do you present to people? What parts do you not? So those are just some of the things that come to mind. There's also some really awesome psychoanalytic thinking, awesome like neurobiological thinking that can help us understand what's going on again in this present moment. But those are some things that come up initially.
I am so struck by this conversation that's really about our inner lives, but how important the external is as well. And of course, I don't know what it's like to be straight or live like that. So I am so struck by how important it feels like both are important, but also the interplay of both are really important for LGBT people. And so I'm going to ask the historian to think a little bit about, I guess, what do you think, we're so grateful for organizations like Fenway and Howard Brown that really took charge of our healthcare when other healthcare institutions were, quite frankly, hurting us, right? They really built our own. I always think of them as islands in the stream. Do you get the sense of this? It's sort of a similar interplay of building an internal world, external world, and making our own world. Katie, what is that about making our own world when others won't?
Yeah, I mean, I think it's one of the greatest strengths of many minoritized communities, honestly, to realize that in the face of oppression, sometimes you just have to build from within. And so looking at the history of gay medical infrastructure, for example, like the Fenway, this is started by gay people who were living in a community and they were trying to save that community actually from gentrification. So they worked with their neighbors to build a health center to try and build political pressure so that it would make it harder to tear the neighborhood down. And that was a moment where gay people in the community were like, hey, if we're building a health center, how about if we create something that actually addresses my health needs? And that was something that kind of sprinkled across the country and has continued to fuel things, whether it's from the AIDS crisis of realizing that mainstream medical services were not meeting the needs of gay men in particular, to now with COVID. And I think that it is really interesting to watch and see, as every single day, I feel like we're seeing communities respond to the crises of today, whether it's Black Lives Matter or COVID-19 or the intersection of those two things, really kind of create new ways of building community and finding and identifying what they need and how they can provide that support within the very particular kind of constraints that we're faced today, like social isolation.
Yeah, I'm curious, Robbie and Cecil, what you see amongst patients during this time in terms of building this life, about building a life when, you know, in spite of it all. I'm curious. I don't want to quite sort of frame it as like we're all so resilient and everything's going to be okay, but what are some of the ways that we could reveal to our audience that LGBTQ people are bolstering or building their life during these times? Curious.
I'll maybe start, if it's okay, and just say, you know, there was a lot actually that was happening virtually in the queer community before COVID happened. And I think that we have in many ways been able to capitalize on that incredible network. The chat rooms, the virtual meet and greets, the ability for people to reach out to peers all across the country and know that there's somebody out there who supports them. There's someone else out there who is going through the exact same thing that they're going through. And so the queer community, in some ways, had a leg up as we went into social isolation. But I want to be honest, right, and say that the struggles of the queer community didn't go away just because COVID-19 happened, and it has been challenging. You know, I saw someone last week who came in to the clinic and said, I don't have a place to stay. You know, a young trans woman of color who said, I'm being kicked out of the room that I have. I don't have a place to go. I don't want to go to a shelter because COVID is in the shelter, and how am I going to survive that? And you know, that struggle of homelessness, that struggle of, you know, really trying to figure out how are you going to survive, that exists even through COVID, and is probably exacerbated by it. So we have this sort of dual side, right, where we have the tools in place to be more resilient and to push forward, but also we're still facing so many challenges every day.
I'm struck by that, Dr. Webster. Is that a good thing that I have both going on, external and internal?
Well, it's a function of our reality. Like if we look at it from a developmental perspective, we are constantly negotiating internal versus external. I don't know about you, but for myself, when I was young, I would experiment with being a skater kid. It's not very good at it. Or experimented with being an artsy kid. I was much better at that. But we tried things on over time just to get a better sense, like, does this fit? Does this not? How is the world going to interact with me in this way? How are they going to like shun me for this way? Like it's a process. So as Robbie was saying, we fortunately have had a really, we've had a leg up in many ways in terms of developing those online virtual communities to support one another. I will say that, you know, sexual and gender development is still happening with kids and adolescents and adults at this time. Even though the world has stopped in many ways, as long as people have an internet connection, they might be able to see, hear, or experience things around that, like trying on new things in ways that perhaps we might have done at school or at our neighbor's house or with our older sister, for many of us. But at the same time, that also creates a lot of dilemmas. I can't tell you the number of young adults that are coming back home from college after having been really involved with their their queer community, being really involved with their same gender partner, being really vocal about what it is that they want, what is it that they need, and really feel like all of that has been curtailed in their home environment. Not necessarily to the fault of one's parents or the busyness of the household. Perhaps their younger brother's there, perhaps a grandmother is living with you, but really not feeling like they have the same level of freedom to try stuff on, same level of freedom to really explore aspects of their masculinity or femininity with people that might encourage or celebrate those things. So there's a lot of shifts. We have great ability to connect with one another virtually, but that also leads to some difficulty in that Corona has really pulled us back to places that might have not been as conducive for those things.
Right. But it's such a good reminder that our development doesn't stop just because I'm stuck inside, right? And that we still continue to grow. That's really, really an important thing to remember. One of our questions does talk about this, and maybe we can think about some strategies. Dr. Webster, I'll start with you. For young people who are at home without internet access, I work with young people who, just like you mentioned, the house is now full of people. They can't really speak freely or be on the internet safely. Gosh, I think we're looking for some real tactics here. What do young people do without the internet if we are stuck at home? Let's all get creative here. What's some good ideas?
Yeah, I think that's going to require a lot of creativity, because on one side we have to balance the need for public safety with like physical distancing and abiding by rules that help all of us to be healthy. But on the other side, we are social beings, and a part of our development occurs with other people. So it might be that in your house, perhaps it's that your grandmother is really open to you trying on her, her low heels, perhaps, or perhaps it's your neighbor who might also identify as queer in some ways. Maybe you guys can go to the backyard and talk a little bit about your experiences, or what you fantasize about, or what you want to do, or where you want to go to college, whatever it might be. I think oftentimes we can really rely on the internet as being a very useful source to create and maintain these communities. But also in-person still exists. Physical distancing is a thing that we need to take to heart. But at the same time, you can still talk with people and still be physically distant. I can't tell you how many times we've had some like stoop wine at the end of the evening with some friends throughout this whole thing. But it's important to think of how we can be hyper local in our explorations.
I love that. Yes, and it does. I too. We have a few other couples where we have some socially distanced wine, and even 1 hour once a week has really made a difference. It turns out I don't need that much gayness, but I do need a short, strong dose of it. I can't help but think, Katie, I'm going to put you on the spot. I want to give a shout out maybe to libraries and books. So I'm going to put the historian on the spot. Sorry, I didn't prepare you for this. We all have probably some of our favorite books. Maybe we could highlight, I'm thinking about how we used to watch books and movies that weren't obviously gay, right? Where there was subtext, or it was a surprise gayness, or, it was a classic piece of literature, but could be read sort of as an other. What are some ways that people who are home, young people, could read or watch things, read about our history, that might keep them a little bit more safe, but maybe help develop their inner minds? Professor Batza.
Oh, man, that's a great question. So, yeah, I think that there is a lot. It's kind of a celluloid closet moment, right? This notion of really finding all of these kind of innuendos, whether you're looking at films from the 40s and 50s up to today, where it can be a little bit more open. There are tons of great books. I always really kind of try and highlight some of the interesting scholars that kind of just shine a spotlight on this existence. And I think, kind of to your earlier question that Dr. Webster answered, one thing that people can do when they don't have the ability to commune with other people who are LGBTQ, they can go inward and have a creative outlet, whether that's writing their own thing or writing their own songs or speaking in code to them, in a poem or whatever, so that they can really kind of still have those conversations be outside of their body. And so certainly you see that in lots of different writings, whether it's, Alice Walker or John D'Amelio's texts are amazing in terms of providing a little bit of history. Michael Bronski there in Boston is amazing. They're just there are so many different kind of viewpoints to look at. I think you can go way back in time and look at Jen Mannion's work. You could even, the historiography is huge.
The well of loneliness, right? I mean, that's such a wonderful, I'm loving this thought about thinking about what we read before, you know, the young people today don't understand. We didn't have Netflix, right? We had movies that we were reading into. That I was just, this is the anniversary of But I'm a Cheerleader. And I was, you know, reading a wonderful a story about just the wonderful life that's out there. So maybe this is the time to rediscover, you know, Walt Whitman's poetry, Emily Dickinson's poetry, reading James Baldwin, all of the things that are on our K through 12 reading lists, but we didn't even realize they were subversive. I do want to get to some of the questions, maybe in the chat. All of you can leave some favorite books that young people could look up that will help them develop their inner lives. Let's talk about trans people. We are passionate about transgender people here at Harvard Medical School. I'm so proud to say that we're really trying to lead the way in medical education. Again, trying to right some wrongs about how we have misunderstood gender diversity throughout history and time. Trans people, non-binary people have always existed. And medicine is catching up to support them. So I'm proud to be seeing Harvard take the lead in transgender support. Robbie Goldstein, talk to us on a couple levels. You're doing on the ground work supporting trans people. How can we support? The question really is about, in light of the current occupant of the White House's terribleness, how can we support transgender people?
Maybe can I put this in the context a little bit of the whipsaw, the news that we had from the Trump administration and from the Supreme Court over the past couple of weeks, and how that has really played out in the trans community. You know, as most people know, it's now been 2 weeks since the Department of Health and Human Services came out with in my opinion, a very terrible ruling that redefined the Affordable Care Act and paved the way on that Friday afternoon for the federal government to discriminate against transgender and non-binary folks in the healthcare setting and to potentially limit access to healthcare for trans and non-binary folks. That was a very unsettling Friday afternoon. It was a very unsettling Saturday and Sunday. It happened in the middle of Pride Month. It happened on the anniversary of the Pulse nightclub shooting. It happened at a time when trans and non-binary people and queer people all across this country are feeling under assault and feeling isolated and feeling all of the thoughts that we're talking about during today's call. And then on Monday, the Supreme Court, the following Monday, the Supreme Court made a decision looking at the exact same word, sex, in a different piece of legislation, the Civil Rights Act, and defined it quite broadly, saying that sex does include sexual orientation and gender identity in the context of employment. And I will say that, you know, we can have a long conversation around government and policy and what this all is going to mean and the path forward in front of the court. But on the ground for people, for trans and non-binary people, this has been incredibly confusing. And people don't know, will I be able to get care tomorrow? Will I be able to get the surgery that I've been looking for over the past 18 years of my life? Will I be able to have it 6 months from now? And that ambiguity about future and about access has been incredibly challenging for the folks that we're seeing here in the Trans Health Program. We made a very conscious decision to reach out to every single patient that has ever come into contact with the Transgender Health Program and has been a part of our community here to say, we've got you, we're here with you, and no matter what happens at the federal level, we are going to do everything in our power to make sure you have the care that you need, that you are able to access whatever it is that you need. I think us as a community, LGBTQ and allies, everyone involved, I think it's our responsibility to reach out to those that are trans and non-binary, those that are facing this ambiguity and say, we're here for you, we're going to stand with you. We don't know what that means yet, but whatever it is, we're going to be here to help you and to get through all of this together. I think it's the only way that we can provide people that reassurance and begin to bring back some of that ambiguity and that fear that people have about the next 6 months.
I love that message about saying the words out loud. I'm with you, I see you, I will fight for you. Dr. Webster, other questions are coming in about supporting people of color, really looking at, we're very aware of the disparities facing the Black community in COVID. What words do we need to be saying to support Black people in the LGBTQ community?
Well, I would actually push it even beyond words. It's really also very much about action. So in terms of like supportive words are really lovely for Black and Indigenous people of color during this time. As I was mentioning earlier, it's a really important aspect of our, like just being a general human, to have all of our, like our whole selves be identified, be supported, be acknowledged, be seen. So it's much to your credit, obviously, with regard to some of those books, for example, like, you know, queer, gay, these are all relatively new words in terms of the experience of humanity, but they've been, you know, these things have been around for quite a long time, and people have done a really great job about writing about it. So we can acknowledge people, and that can feel really good. One of the things that frequently comes up for my sexual or gender minority individuals in my practice is that while the outpouring of support verbally has been very nice, there's still questions like, okay, like they sent this text message, but like, what are they actually doing? Like, well, you know, like they put up the black square, or they put something on Instagram, but like, do they actually make any changes at work? Have they invited like a person of color to actually speak about this or that? Have they like supported like these restaurants that are struggling? Are they in a position to give like loans to people and think about how they might be participating in the marginalization of people of color? So I think a larger part of it was like, what is it that we can do? I don't think it's quite enough just to simply acknowledge or simply just see a whole person, but rather like, how are we going to take action to shift a system that really penalizes people of color.
Mm-hmm. I was really excited this morning to see one of the libraries at Harvard, I'm sure a librarian from there is on right now, announced that they are shifting all of their digital archiving work to doing all Black history for that archive. So again, seeing the shift of resources that you just discussed, and for those of you who know, Harvard has an incredible opportunity to digitize its archives so we can start to learn about Black history for all of us. So it was exciting to see a real a statement about using resources in a completely different way. That anxiety about money or who's going to do what, but actually just shifting the resources is, you know, I don't think any new money is being spent, but the current money is being spent differently. And I was excited to see that about the digital archives. Speaking about this idea of bringing all of ourselves together, we have a question about thinking about older LGBTQ adults. And I know we've all been quite struck by thinking about what is happening in nursing homes. For those of us in the LGBTQ community, thinking about aging can really keep you up at night, speaking for myself. So what can we do? I mean, this question is really about how can we make sure, what could we be doing to think about our elders and our aging folks inside of our community right now? What are some strategies? Robbie?
You know, I'm going to say something that I said earlier, which is that we've got to remember that some of these things, these struggles were going on before COVID. And we were having a really active conversation and really trying to work hard to think about aging LGBTQ folks all across Boston and all across Massachusetts. And we've got to continue to do that work. And the reason we were doing it before is that these are the people who are most isolated. These are the people who, you know, it may have been really hard for them to come out maybe later in life. And now they are in a setting where they need assistance. They need that community structure that a lot of elderly people need, and they're not in the most affirming of spaces. I said at the beginning, we have a lot of patients who are in their 70s and 80s, who are either moving into assisted living facilities or communities and are trying to figure out, do I come out at the age of 80, do I come out to the people that I'm around, or do I not share my trans identity, my queer identity with folks? You know, this is hard. It's really hard because we know that older people are the most susceptible to this virus and have the highest mortality risk from this virus. And so obviously we need to do what we can to make sure they have physical distancing in place, but that doesn't mean that we shouldn't be calling our elderly friends in the queer community. It doesn't mean we shouldn't teach them how to FaceTime and use Zoom and do virtual visits. It doesn't mean that we shouldn't be thinking about how those community centers need appropriate testing and personal protective equipment and all of those things, but they also still need social programming. They need places where people can gather for meals. They need events to happen on the weekends. And so we have to keep pushing forward the work that we were doing in 2019, even though it's 2020 and we're dealing with this enormous pandemic.
It makes me wish that, you know, we were really spending this time as a community thinking about where are we going to shift our resources? How are we going to, what are we going to focus on? And of course, thinking about older people feels like a real priority. And I'm really glad that that question came up.
Jessica,
please, Katie.
So I also just want to say, as we think about kind of the struggles that elders within the LGBTQ communities are feeling right now, I think that we need to also highlight the fact that many of them, not all of them, were already out and active as the AIDS crisis was playing out in the early 1980s and 1990s. And for many of the people that I work with and that are in my research, many of them are kind of struggling with the fact that yet again, there's a slow government response. There's a high mortality rate. It's disproportionately hurting people who are already minoritized and ostracized in different ways. And this is an incredibly challenging emotional event for them, in addition to all of the lived struggles that they are going through in terms of isolation and facing a potentially very deadly disease. And so I think as we reach out to our elders and try and support them, we need to provide space where we acknowledge that this could be something that they are feeling, grappling with, struggling with. And I also want to say that some of the folks that I've spoken to kind of are able to look back and see that also as a source of strength of we've been through this before, we will survive again. So I just wanted to throw that out there.
Well, you've made me think, of course, we're here under the Radcliffe umbrella. I can't help but wonder, you know, who's capturing these stories? Is this the time that we should really be investing in some oral history projects, maybe where the young people who are at home are interviewing the older people at home and really trying to capture the lessons learned? Maybe that's something the Schlesinger can do, or someone on this call is in charge of oral history projects at Harvard. But I think you're right. There is something that's going to be triggered because of this virus about the last virus. And it would be a shame to not really capture that. Dr. Webster, we have a very specific question about young people. And I have heard this. I was with some pediatricians last night who were also concerned about young people. And I think I'll expand this question. Young people and adhering to COVID advice and being mindful of where they are developmentally. And also this question is about sex, not being able, I don't know why it's young people having just sex, Charles. I think that we all want to have sex. But Cecil, help us understand young people right now. Boy, they're driving me crazy.
This is a very unique time. Again, I want to emphasize that sexual development does not stop with coronavirus. So a lot of that has shifted online. I get to hear a lot of choices around sexual contact and exploration digitally in my office, as an example. But it's a natural part of our being in many ways. There's a sort of neurobiology of it, like the parts of our brains that are responsible for being able to predict outcomes of stuff and being able to manage like how things might develop in the future. Like those parts of our brains are really not fully developed until 25. And it's a part of our job as adolescents, for example, to find out what those limits are. And parents' job to really allow some of that sort of longer term thinking of like what are like risks and consequences as well as what is joy to really take form in one's child. But I will also say, you know, sexuality being such a like a strong central part of our lives, not just with young people, but with all people, I think we should have those conversations about, okay, like you know, you're like 16, you've got this this girlfriend, this boyfriend, whomever. Like, how is it that you are engaging around this? Like, how are you engaging with your sexuality? That might be a step parent, might even be like a grandparent. I certainly ask those questions a lot in my office. And I'm often surprised about what I hear. But I think we need to acknowledge that it is occurring, and then we need to think about it. And we can also help young people think about how to balance some of those things. Like, oh, you really want to go see your girlfriend? Awesome. I'm very excited. Like, we're really getting into some of that pleasure. But, you know, let's also you mentioned that your grandmother is at home. We should also think about that as well, like the possibility of her health as well. So there are lots of things to consider.
Oh my God, nothing like the message, having sex will kill your grandmother. Boy, that's, I heard that, and I might have been told that as a young person. What a terrible message, right? How do we not get some of this terrible messaging at this important time? And what I hear you say is really about being a grown-up with a young person and engaging in vulnerable, honest conversations. Dr. Goldstein, you talk about sex all day long with patients. And for years, you and I have talked about what advice you have. So there might be some parents and some folks on this call who would like some advice about talking about sex with their LGBTQ young people. Give us some thoughts.
Well, you're right. I do talk about sex all day long with my patients. I guess I'll go back to some of the basics that you, Jessica, and we've been talking about since the beginning, right? Which is that we should not be stigmatizing sex. We should not be stigmatizing this experience that people are going through. I have a tremendous number of patients that I see for PrEP, for pre-exposure prophylaxis, who traditionally were coming in and seeing me every 3 months, and we were talking about sexual partners, and we were talking about HIV risk. And I'm now seeing them, and I ask them about their overall risk for COVID, and are they taking precautions and wearing masks, and we talk about that. And they also then share with me that they're having sex, right? I could stigmatize that and say, you are increasing your risk for COVID and stop doing that. That's not the right thing. And that would actually put us back so much further in this work that we've been trying to do. And instead, I do allow what we just heard about, right? Which is, let's talk about the overall risks and the benefits. Let's talk about ways to decrease any harm that may come from this to yourself, to those people you live with, to the people you're having sex with. Are there other ways that you can experience this pleasure? Are there other ways that you can connect with people? Are there ways that you can maybe form a little bit of a pod or a quarantine pod where you have the same sexual partner and you're making sure that both of you are staying safe and not putting yourselves at risk for COVID, right? It's about taking the stigma out of it, not ever saying that it's bad, but simply saying, how do we do this safely? How do we do this in the best possible way to keep everyone safe?
Right, I love
Jessica,
that.
might I add one other thing as well? Like, I think often in America, we as Robbie was saying, tend to stigmatize sex, but we really don't emphasize its pleasure. Like, it's a fun thing. We can acknowledge that it's a fun, wonderful thing. And also for young people in particular, a lot of this has been curtailed, and a lot of young people have a lot to mourn. Maybe they don't have the opportunity to have sex for the first time, or have their first kiss perhaps, or develop a relationship with another person. So we also need to keep in mind what a lot of young people have lost during this time as well.
Yeah, sex is fun. Let's say that loud and proud here on the Radcliffe webinar. I want to acknowledge, we've got a lot of great questions coming in and not a lot of time, but I must acknowledge we've got a few folks who have let us know that they are HIV positive, they are living with HIV, and I want to thank you so much for joining us. So let's talk specifically about our beautiful friends living with HIV, and it sounds like some anxieties are coming up about seeing people without a mask, right? How do I navigate? And I think for all of us, how do we navigate this feeling of going outside, wanting to start to get back out there in a safe way, and then being confronted with people who are not taking it seriously, especially for those who have real reasons to not be exposed?
Well, let me speak about this from a clinical perspective in terms of our mind and how we make decisions. So when we are fearful, when we have this fear of being harmed, and if we think about it from a psychoanalytic perspective, our fear of annihilation, what we tend to do is to dehumanize other people, as well as really get more in touch with those more base parts of ourselves that really want to annihilate somebody else. So oftentimes, what does that look like with like being an HIV positive person, for example, that's worried about the risk of harm with somebody not wearing a mask? It might be that we yell at this person, like, I can't believe they're being an animal. They're not right. I encourage people to take a step back from that, because that ultimately, like, yelling at somebody on the street is not necessarily going to solve that problem. But it might be that you make your own changes to your own life and mitigating your own risk. And you know, if you can have a nice, calm conversation with somebody who's open to hearing that conversation, perhaps you can make a difference with that individual. But ultimately, I would really make sure that, especially for somebody that's immunocompromised, keeping in mind themselves, like how can they lower the risk to a point where they feel comfortable, also acknowledging that they may never feel perfectly comfortable. There is risk, there will always be risk. But maybe you really just want to go sit outside on your porch and like wave to your neighbor, whatever it might be.
Thank you for that reminder about dehumanizing people. I have had those moments, I must admit, during this crisis. It's not brought out my best self. Robbie, help our positive folks feel better today.
Yeah, I'm going to say something very clinical, and then I actually have a question for Katie about this, because I think the history is really interesting here. You know, clinically, I'm going to say, for folks who are living with HIV, if you're taking your medications, if your viral load is undetectable, your immune system is functioning and healthy. And as much as we know with COVID, and we really only know a little bit about this disease, we've only known about it for 7 months now, but for as much as we know, you're not at an incredibly high risk for the virus. The risk probably comes from age. It comes from the other medical conditions that you may have, like heart disease or diabetes or COPD or asthma, more than from your HIV. We also know that people who are living with HIV sometimes have different presentations of COVID. And so the normal symptoms from COVID that you might hear from other people may not be the things that you see in yourself. So it's really important to have a relationship with your healthcare provider and to call with anything that's concerning to you. But also just know that you're not at super high risk just because you're living with the virus. If you're taking your medications, you're protected. The history question I would love to get Katie's thoughts on are that I think back, I love sort of that period of time from 1980 to 1988 in the HIV epidemic, and thinking about what it was like for gay and bisexual men, you know, a large portion of that population were gay and bisexual men, what it was like to go out and have sex. Once we knew that this was a virus that was transmitted by sex, and once we knew that it was in this population at such high prevalence, and that mentality that people were going through, and what we did sort of historically to get people to feel comfortable with having sex again, get people comfortable with going out and being social again, recognizing that this virus was there.
Sure, this is a great question, and I think it dovetailed nicely with the other question as well. And I think the key here is having conversations, having frank conversations about how we're all trying to navigate this. People who are positive have a robust just bevy of different social service agencies and community groups that can work together to kind of share information and make the public aware that it's not just because a mask is uncomfortable, it's because it's saving people's lives, and that people who are immunocompromised exist out in the world. And so I think there's that piece. But yeah, that moment before AZT, which was the first drug that was FDA approved for HIV in 1987, there was this really kind of intense period where there was a lot of rhetoric and shame around having sex or how to have sex safely. And there was a lot of kind of knowledge gathering, community group building and education being shared around how you could navigate social situations, how you could pursue sexual partners, how you could do so safely, and or at least knowledgeably about the potential risks that were inherent in those kinds of interactions during that time period. And I think there again, it's about having meaningful conversations with potential partners and other community members, but really embracing the infrastructures that we've built over the last 50 years to try and share information with folks that are maybe on the outskirts or even outside LGBTQ communities about the risks that their own behaviors have and how they can make slightly different choices that will have serious impacts for folks who are positive.
A good reminder of this time is learning about the history of some of that public shaming and personal shaming that went on in the beginning of HIV, and not to replicate that again today. Katie's book is terrific. We'll make sure everybody knows how to find it. I'm going to do a quick round robin as our final thought. I'm going to ask everybody the resiliency question, all right? We've got an incredible audience. We've had about 150 people with us today here at Radcliffe. I want to talk directly to the LGBTQ folks who are on the call, maybe those who are young. What are some ways that we can fight this feeling of isolation, take on some healthy behaviors that we might want to be drinking more these days? What are some healthy ways to fight isolation? What are some of the things that we can do inside? Katie, I'm going to start with you. I know you're there in the corner of your room. What's some advice you have for this moment of staying up?
Sure. Well, I mean, as a historian, I often look to what people did in similar times in the past, right? And so I know that there are things that we can do. We can augment our behavior without giving up our community. So really embracing the technology that we have and do as much as what we did before that brought us joy. So, reach out to your drag performers, try and get a drag show on, either socially distanced or virtually, or just really reach out and try and build communities. I know that often, especially younger folk, it's important to be able to go to bars or community places. Well, a lot of those sites still exist virtually and try and gather people together. And if they don't, then try and build them. We have all these platforms to do this. And I also think it's really helpful for us in this time to think bigger picture, right? When I think about the early AIDS crisis, one of the things that helped people who were very advanced in the disease before there were really any treatments, they dedicated their lives, their everyday activism, their everyday existence to activism, to try and shape the larger trajectory. And so think about, there's big, huge moments right now, Black Lives Matter, climate change, all of these major issues. Get involved, and you can do that from the corner of your bedroom.
Mm-hmm. That's great. Robbie Goldstein?
I want to recognize in answering this question that it's Pride Month. And this is a month when the LGBTQ community usually comes out in force, right? And we are hundreds, thousands of people strong in the streets, marching in parades. We are going to events. We are social the entire month. And I think there's a sense of loss that we're missing out on our 1 month to celebrate our community. And I want us to remember that Pride Month is a month when we recognize all the work we did in the other 11 months. Pride Month is not the only month when we care about LGBTQ people. Pride Month is the month when we get to share with people, look at all this amazing work we've done. So I don't want anyone to feel a loss over June and missing out on all of these things, because we will march in the streets again. We will have events and have a lot of fun. And we're going to continue every single day to do the work to make sure this community has what it needs.
That's great. All right. My favorite therapist, Dr. Webster, help us.
No problem. All right. Oh, first of all, I very much look forward to marching the streets, as Robbie said. That'll be very lovely. But let me speak directly to these young queer people specifically. This is your moment. You are the most prepared for this moment. You are fluent in your use of Instagram and TikTok and Twitter and everything else. You have a great ability to build communities in ways that many of us will never be able to be fluent in. And you are going to be the people that inherit the difficulties that we've had, but also the chance for success with this. So I need you to get to work, connect with your friends, put aside some of the difficulties around this, but really engage in this as a challenge that you are up for. And I think we will all be better for it.
Oh, that was, I needed that. Thank you so much, therapist. Boy, I'm going to close. Sorry, we went a little bit over. I want to thank everybody from Radcliffe. So again, to all of our presenters, Robbie and Cecil and Katie, thank you so much for joining us. Radcliffe, I hope this is just the beginning of lots of great conversations and resources spent on LGBTQ lives. Thank you so much. I want to make sure everybody knows that they're doing this wonderful online series. And next up is on Monday about American policing and protest. You will definitely want to check in on that. So this is just wonderful. Thank you all so much. And we will see you next time here at the Radcliffe.